From EGA, we've got a big interest in looking at people as a whole. I often joke that IV drips are the gateway drug into longevity because there's two that really sort of stand out, I suppose. Like one, does it actually work? And obviously, is it kind of safe for the person who we're treating? There needs to be value for the client. They need to feel looked after, and they need to get a good result. Say peptides, for example, which aren't. They're in a bit of a grey area at the moment. So we're keeping up to date with all the kind of legal rules in the UK about what we can offer. If they want to do these treatments, we can offer them in a safe and effective way.
So hello everyone, this is Kay from TimePie. We are here at London to explore the latest trends of local longevity medicine in London. And so we are honored to be invited at EGA Clinic, a wellness clinic here focused on longevity medicine. We will talk about their anti-aging protocols, their operational models, and their practices. So welcome, Mark.
Oh, thank you. Well, thank you for coming. It's a pleasure to see you all. So thank you very much.
Thank you for having us.
Welcome.
First of all, please give us a small introduction about EGA Clinic. Like when a new client comes to your clinic, what's the whole journey or process would usually look like, from the consultation, from the diagnostics, something like that?
It's a great question because I think that's what a lot of people want to know. When we have new clients, I think it's important for us to explore what they're really interested in and what their concerns are, and that typically involves a consultation. So that might be with me or another member of the team. Typically that's with myself, as I oversee the medical side. And in that consultation, we'll go through all of their health history, we'll go through their goals, their concerns. We'll talk a lot about their lifestyle and their background, and from there we'll look at creating a really personalised report which assesses their general health, their potential kind of risks from a longevity and health point of view, and areas where they can target to get the most improvements. From EGA, we've got a big interest in looking at people as a whole. So we use, obviously diagnostics that we'll touch on now. So that can be in the form of, say, blood testing to look at a wide number of biomarkers that are related to longevity. But we'll also do some other testing which is maybe slightly different from traditional medicine. So I've got a big interest in sports medicine. So we'll use testing that relates to physical fitness, so that will be the circa VO2 max, or some strength testing to look at how if there's any imbalances or weaknesses in your muscles. We'll also do tests of your skin health to look at how healthy your skin is, and then we'll do some other nutrition-based testing that gives us a really in-depth view of any kind of nutritional deficiencies or markers of stress that we wouldn't necessarily get from a blood test. And from there we'll try and pull all this data together to outline a program of a plan for people. But that does vary person to person. But typically we'll have this consultation, we'll arrange some testing, and then we'll go from there with these plans. And with our clinic, we're very lucky to have the space and the facilities to offer a lot of these treatments sort of in-house as well.
Interesting. So when a new client, they leave their clinic, how do you do the follow-up process? How do you ensure they can keep a long-term health management even they are not here anymore? They can keep to that habit and stick to it.
No, absolutely. I think compliance is a massive thing when it comes to these areas. So after our initial consultation, we'll aim to get a report out either the same day or at the very latest the next day. And then we'll give it about 48 hours and we'll contact the client again, just very gently. We're not trying to push anything on them. And we'll say, you've had the report, do you have any questions? Would you like to arrange a telephone call with our doctor or one of the healthcare professionals as part of the team to go through it? And then we can look at getting people booked in for those treatments. And there'll be the foundations of longevity medicine really are in those behavioural habits. So we'll give them these kind of prescriptive plans and try and keep checking in with them every few weeks to see how they're getting on, and we'll hopefully aim to see them every kind of 2, 4, 6 weeks to check in and do some treatments in-house as well. The idea is that we're there to provide a bit of oversight for their care, to answer any questions they've got, and give a bit of accountability, and then we'll ideally kind of follow these clients up at maybe 6 weeks and 12 weeks to check in with their plans.
Impressive. So, in China, many people began to start their anti-aging or longevity journeys with IV nutrient therapies. So at EGA Clinic, so what kind of therapy or treatment would you expect to be the most popular one? Can you give us?
Yeah, absolutely. I think in a lot of countries, there's a lot of buzz around NAD as an IV. A lot of people are taking NMN, NR, even NAD sort of orally, and they want to know, can they take it as a subcutaneous injection, can they take it as an IV? I often joke that IV drips are the gateway drug into longevity because people come in, they see their friends having IVs and they want to feel better, but then once they're having an IV, we'll obviously have a bit of a consultation beforehand, And then during that consultation, people will ask questions, say, how do I know what is the best thing to have in my IV? And that will lead into questions around diagnostics. And I'll say, what else can I do when I'm here? I like, you've obviously got lots of services. So it's a nice entry point into kind of treatments. But I think the most common IVs that we do, most people's concerns, I guess, initially are around maybe immunity or energy levels. So there'll be combinations of, say, B vitamins, vitamin C, some minerals, and then NAD is a popular one, which isn't for everyone, but actually I think for a lot of people it can make a really big difference.
Yes. So we can see many new kind of technology or therapies keep showing up every year, like stem cell, gene therapy, etc. So when you are evaluating a new technology into your whole system, what are the core principles or criteria do you value the most? What matter most to your team?
Yeah, absolutely. I think there's two that really sort of stand out, I suppose. Like, one, does it actually work? Does it deliver what we're trying to do? And obviously, is it kind of safe for the person who we're treating? Because they're the two things we want to do. We want to make sure that we are looking after our clients who come to see us, because people are putting a lot of trust in us, and to look after the health, to give them the best outcomes possible. When we look at, say, a new treatment, say, and we can talk about gene therapy. We look at, does it work? I suppose, who's currently offering those treatments? How are they offering those treatments? Are people not offering them because they don't know about them, or are they not offering them because they don't think they're safe, or are they concerned about them in some way? And do we want to be associated with the kind of people who are doing those treatments? I think gene therapy is a good one. It's one where legally in the UK it's not quite allowed, but we know that we can refer clients elsewhere to get it, and we do seem to get some good results, and we hear some really positive things. So I think in terms of that criteria, again, it's is it effective, is it safe? Because that's the most important things. Then we look at who else is doing it, why are people doing it, why are they not doing it, and then how does that fit in with the ethos of the clinic? But ultimately, we just need to make sure that we're offering our clients the best care possible.
That's true. So in your whole diagnostics or treatment system, you got many advanced therapies like BHRT, TRT, or high dose NAD+. So as a strictly regulated longevity institution, how do you balance that kind of medical innovation with clinical safety and compliance?
It's a good question, and it's not easy at times.
Yeah, it's a tough one.
We kind of pride ourselves on making sure that we are compliant from a regulation point of view. We do take that seriously. There's the Care Quality Commission in the UK, which looks after all the medical treatments, and we're going through the process at the moment of being registered. I'm very familiar with the CQC, and we look at those treatments on kind of merit and safety. We check around the rules and regulations around those treatments. We know that hormone therapies are regulated and they're allowed to be offered on the CQC, but we make sure that we've got policies and procedures in place to make sure we're doing things appropriately, so that we're storing any kind of medications well, that we've got proper follow-up documentation and procedures in place, that we're looking after our clients again as best as we can, and making sure that we're doing that as safely as possible. So we make sure that we keep up to date with any kind of changes in those regulations. We've got a whole raft of policies to make sure that we're safe, and if there are any changes, we obviously have to update what we're doing. NAD and IV therapies have also in the last few years become a medical activity. So again, we just have to make sure that we are just being compliant. And if there are any services that, say peptides, for example, which aren't, they're in a bit of a grey area at the moment. So we're keeping up to date with all the kind of legal rules in the UK about what we can offer, and we just try and educate our clients as best they can. So if they want to do these treatments, we can offer them in a safe and effective way.
Interesting. So last question. We are a little bit curious about your pricing system.
Sure thing.
So if you're very comfortable sharing with us. So what's the typical spending for a new client when they do the first consultation or assessment?
Of course, yeah. It varies a little bit person to person. The initial consultation price is very similar to paying for a consultation with either a private GP, which is my kind of background, or with a cardiologist or another specialist in healthcare. So it's in the region of sort of several £100s. So that £300-500 mark is what we're paying for, depending on the length of the consultation. Blood testing again is fairly similar. There are some tests that we do which are a little bit cheaper. They have less markers, but they're still useful. And then we kind of build through the different tiers of not complexity, but detail, I suppose. So our more advanced panels are more expensive, so probably closer in price to our consultation prices. And then we can look at putting together programs for people which would involve either repeat testing or courses of therapies, and that they can be more expensive, and they can go into maybe sort of four figures, sort of in the course of like a few £1,000s. But again, it's very much aligned with private healthcare in the UK, I suppose. They're kind of ballpark figures for what we tend to charge. So it's probably a few £100s for the consultations, the blood tests are similar, and then it depends on the length of programme. So if we're looking at a 6-week or a 12-week programme, we are looking at sort of probably several thousands of pounds. But as part of that, we want to make sure that clients are getting a really good value. So we offer a really good level of follow-up and detail. We've got members of the team who contact clients regularly. We make sure that we're really on top of our standards, that we offer the best treatments possible, and we really want to make sure that clients are getting results for what they're paying for.
Yeah, results are the most important.
Absolutely, yeah, absolutely. They need to, there needs to be value for the client. They need to feel looked after, and they need to get a good result, and that's what we're focused on.
Yeah. Okay, that's all for our question. Thank you so much.
Oh, thank you. Lovely to meet you. Well, thank you.
Me too, likewise.